Good afternoon, everyone. Today I will be discussing the strengths, weaknesses, validity concerns, and key assumptions of phenomenological research. One of the main strengths of phenomenology is its humanistic perspective. This approach focuses on understanding the person as a whole and values each individual's meaning and perception of their experiences. Instead of focusing only on numbers or measurable outcomes, phenomenology tries to understand how people actually experience a particular situation in their everyday lives. Researchers usually gather this information through in-depth interviews, which allows participants to share rich and detailed description of their experiences. Because of this depth, phenomenological research can contribute to theory development, professional practice, and sometimes even policy changes. In healthcare, it is often used to explore experiences such as living with chronic pain, receiving a cancer diagnosis, or the emotional challenges nurses face when working in a high acuity environment. In my own surgical practice, understanding a patient's lived experience is very important. When patient comes in for surgery, for example, we often focus on clinical aspects such as vital signs, lab results, or the surgical procedure itself. However, patient may also be experiencing fear, anxiety, or uncertainty about the outcomes. Phenomenology reminds us that these emotional and personal experiences are just as important as the physical ones. Taking the time to listen to patients and understand how they experience their situation can help nurses provide more compassionate, holistic care. At the same time, phenomenology also has some limitations. One challenge is that it is highly subjective, meaning that researchers' interpretation plays a large role in how the data is analyzed. To reduce this influence, researchers often use strategies such as reflexivity and bracketing. Reflexivity meaning the researchers continuously reflect on their own beliefs, experiences, and possible biases throughout the research process. Bracketing involves trying to set aside personal assumptions so the researchers can focus more clearly on the participants' experiences. Even with these strategies, biases cannot be completely eliminated. Phenomenological studies also usually involve small sample sizes, which means that findings cannot always be generalized to larger populations. In addition, the research's process can be quite time consuming because interviews need to be transcribed and carefully analyzed to identify themes and the underlying meaning of the experience being described.